Phlebotomy is the process of making a puncture into a vein to drawing blood. This is another very important step in the blood collection process. A proper collection technique is essential to minimize contamination and is for donor safety. The moment we are waiting for is, when do you actually draw? Phlebotomy can be performed only after donors become eligible for blood donation. That means the donor has passed physical examinations and there is nothing on the questionnaires that will deter a donor from donating. If you have not yet watched donor qualification process, please check it out after this video. I will leave a link to it in the description box below. Prior to vein puncture, the phlebotomists have to properly identify donor, label the collection bag and test tubes with Donations Identification Number label or DIN. Donor identification number is really important because from this point on, the donor will only be identified by donor number. Laboratory personnel will not immediately know who the donor is by looking at the test tube or the donor bags. This is to help protect donor identification and privacy. However, this does not mean that we cannot track a units of blood. We do have systems that would allow us to track any units of blood to where it was collected, who the donor was, and to whom it was transfused to. This process called lookback. The reason that we need to establish this system is to make sure that we have a way to notify the donor and patient in case any information arises or anything went wrong during the process. For example, if the donor current health condition has changed in a way that it will affect the donor qualification, previous donation may be recalled by the blood donation center. This recall process can happen way after the blood is collected. Regardless of when it happens, we would be able to track down the unit. We would need to know if the unit was transfused and who the recipients of the unit was. The patients may get called from their physicians and possibly come back in for a checkup.